So, good morning all. I am going to speak about why do we need a bespoke lubricant and how can we design one. As Dr. Bhaumik sir rightly mentioned that cost is one of the most important factor in management of dry eye. So, if we have a bespoke lubricant which can help our patients, it will be very good in the Indian scenario. A lot has been discussed about DUCE too, so I'm not going to go in depth, but every year the classification and the definitions of dry eye are changing. But we are here giving the same treatment to all our patients. So the question is, every year the definitions are adding, but do we have treatment for each of the different pathways? And do we understand each pathway of the dry eye? So to find answers, my first part of the talk is going to be why do we need a bespoke lubricant? Right now we have two options of lubricating drops. Either they are normal lubricating drops, which are CMC, HPMC or hyaluronic acid, which helps us in replenishing the tear film dysfunction and alleviate the symptoms of dry eye disease. Or we have smart lubricants, which are like cyclosporin, Zidra, tacrolimus and rebamipide, which blocks or modulates the trigger factors, which in turn drives the tear film dysfunction. So what if we can have a next generation lubricant which can act both to block or modulate the trigger factor and replenish the tear film dysfunction? Right now, the smart lubricants, what we have is Restasis, Zidra, tacrolimus, which acts on specific pathway of dry eye. It's not a global one. Either it acts, cyclosporin, for example, acts on the ICAM1 pathway, which reduces the inflammation. Zidra acts on blocking it, and tacrolimus acts on something else. So what if we have something which blocks everything and helps us alleviate the dry eye symptoms? So the current drawback is there are many available therapeutics such as lubricating and anti-inflammatory drugs to alleviate symptoms and reduce dry eye signs and symptoms, but the underlying cause of the disease still remains unattended. And thus there is a need for effective therapeutic agents that target the causative mechanism of the disease. So how do we design a bespoke lubricant? 2 years back, Professor Dr. Yoshinori Oshumi won a Nobel Prize in Autophagy in the field of medicine. So we got inspired by him and we wanted to see a role of autophagy in dry eye and keratoconus. This was what we published last year, indicating that oxidative stress can lead to deregulated autophagy in keratoconus patients, and we also are finding a role in dry eye patients. So to understand autophagy, first we need to understand the housekeeping mechanism of the body. If there is the housekeeping mechanism of the house is messed up, it leads to a dirty and a smelly environment. Similarly, billions and trillions of cells keep dying in our body. If they don't get degraded or die according to the need, it leads to a diseased condition. So who does this? Autophagy. It is a process used by eukaryotic cells to recycle old or damaged cellular components in response to cellular stress and damage. So autophagy is basically, there is a formation of autophagosome which surrounds the degraded cells. It further merges with the autolysosome and it cleanses the degraded and the died cells out of the body. But if there is any defect in the phenomena, it leads to a defective and a diseased condition. So to format any drug or to bring any drug into clinical practice and patient use, this is the format which we need to use. We have to have a concept, idea, then we need to create an experimental model. We need to prove our concept, and then we need to study it in a disease patient model, further followed by clinical trial in patient care. So we did some studies on epithelial cells of the dry eye patients. We took them with the iPrim kit, and then we studied the activity of autophagy in these cells. We found that this dry eye patients had increased hyperoxic conditions in their eyes compared to the normal patients. So this is a small animation which depicts what autophagy is. If there is any inflammatory condition on the ocular surface disorder, it gives rise to the inflammatory components and it damages the epithelial cells on the surface. Whereas intracellularly, the autophagosome which I showed earlier, it takes the degraded cells and merges with the autolysosome to make it die. But if the activity is abnormal or reduced, then the surface epithelial cells are damaged, and which leads to symptoms of ocular surface disorder. So we looked into the literature and we found that trehalose, rapamycin and baflomycin are the drugs which helps us in modifying the autophagy activity. But when we saw the side effects of the drugs and everything, we found that rapamycin and baflomycin had way more side effects than trehalose. So we went ahead and did some in vivo studies on trehalose. We created a desiccation stress model. When we created a desiccation stress model, the cells lost their contour and the shape, but when they were treated with trehalose, there was restoration of morphology of this desiccation stress after the treatment. Also, the lysosomal activity was raised in desiccation stress model, but when they were treated with trehalose drops or injectable drops, the lysozyme activity was normal, and also the pH reduced after treating the desiccation stress model with trehalose. So this is what happens when we use a trehalose drop. Previously I showed that the autophagy activity was reduced, but here after using them in vivo, the autophagosome activity was increased, and it changed the epithelial cell functions and reduced the ocular surface signs and symptoms. So what trehalose basically does, it maintains the corneal cell viability and functions, acts by protecting proteins and cell membranes from denaturation. It induces autophagy and thereby removes misfolded or aggregated proteins and non-functional cell organelles. It also protects epithelial cells from death by desiccation, relieves ocular discomfort, which is one of the most important factors we would like to give it to our patients, and it promotes a healthy ocular surface environment. So basically what trehalose does is it regulates the autophagy, it induces it, and also there is more degradation of the dead cells, and autophagy reduces inflammation, thereby it improves the autophagy activity, and probably a drug which may reduce inflammation and boost up autophagy in order to maintain basal conditions in the cell would lead to a happy patient. So thank you.
Thank you very much, Dr. Pooja, for giving a nice insight into the laboratory background and the research which goes into developing a new molecule. We will wait till the end for questions.